So Health Minister Dr. Aaron Motsoaledi has refuted claims that the National Health Insurance will cost the country 1.3 trillion rand. The NHI bill was signed into law by President Cyril Ramaphosa in May this year, amid criticism from a number of opposition parties and civil society. However, Minister Motsoaledi says NHI is a positive move for those who can't afford private health care. For more on this, we are joined by Minister Aaron Motsoaledi. He joins us now via Zoom. Minister, good morning to you. Thank you so much for joining us for what is an ongoing debate in our country. And I want to actually just get your initial thoughts on the wording that is being used also in talking about the NHI debate. One of the things that you've said is that the public discussion around NHI is something you liken to the way that people talked about the swart gevaar in apartheid South Africa. Explain that for us, Minister.
Good afternoon, good morning, morning, Naledi, and morning to the listeners and viewers. The issue of universal health coverage, which we call NHI in South Africa, is not only a raging debate in South Africa, it's global. It's being debated globally. 2 weeks ago, I spent a week in Brazzaville, where all ministers of health in Africa were meeting. This was a topic. We are going to United Nations next week. It's going to be a topic because it's one of the sustainable development goals of the United Nations, the issue of universal health coverage. So it's by no means a South African debate. It's a global debate. Now, coming to your question, Naledi, I was referring to the manner in which the media reports this whole issue. A number of sections of the media have adopted a fear-mongering approach to this whole debate. In other words, scare people off it instead of sitting and listening carefully and putting up the facts. Just scare them off that this is a monster that is coming. It will cost 1.3 trillion rand, which is the total budget of South Africa. So anybody who proposes it must be mad. You must run away from him because he's bringing a monster that will cost more than the budget of the country, which we definitely know is not the case. Then comes the issues of interviews. Every single sentence you say, it gets distorted. For instance, that Minister Motsoaledi is saying GNU rather collapse than not implement NHI at all costs. You know, it's fear-mongering because GNU is largely accepted by people in the country. It is being accepted internationally. People are having confidence in South Africa that things are going to change. And here is one minister who says it rather collapses. That's what I call fear-mongering. And I am saying it is a tactic which we also saw during the apartheid era, where anything anybody says about liberation is regarded as swart gevaar, and people get scared about this coming freedom, which we all enjoyed after 1994. That's exactly what I meant.
Yeah, well, it's interesting, Minister, because it sounds like obviously, and you're raising issues and concerns around how the media is talking about NHI and universal healthcare being implemented in South Africa, but you're having difficulty in being able to convince the business community as well. You've got, for instance, the Hospital Association of South Africa that seems to have found a compromise. They say, Minister, they say their compromise is that universal healthcare is possible if all workers in the formal sector have medical insurance, right? There was the signing of the compact, not everybody coming to the party. What's the next step and how are you engaging with some of these parties?
Naledi, we are not implementing universal health coverage for business. We are doing it for South Africans, especially the poor ones. They are the ones who are going to be beneficiaries. We are not establishing this business. This whole concept for the benefit of business. No, we're not doing that. The problem is that the business community is following a dictum which a pharmacist and industrialist in Denmark once said. He lived around 1823. He once said, those who have the gold make the rules. And that's the dictum they are following. That now that they've got the gold, they are richer than anybody. They must make the rules for all of us, and we must just follow them, even without questioning or without complaining, even when we meet with problems. NHI is specifically, there's no country in the world that put NHI because business was booming, the economy was booming. All the countries who came up with NHI is because they were experiencing problems. Let me start with the UK in 1948. It was 3 years after the World War. Anybody who knows history will know that UK was battered by Hitler during the Second World War. They were poor and unemployed, and they were afraid that their economy will collapse because rich people, sick people cannot run any economy. That's when then they established an NHS for the poor people, not for the business community. And I think that's exactly something that you ought to understand. But that doesn't mean that South Africans from all walks of life can sit down around the table and talk about this universal health coverage. What I'm challenging is the fact that it is believed that anything that comes from big business, that is the okay one, because they've got all the gold, they must make all the rules for all of us, and we must follow. Now, you spoke about the compromise. We don't know anything about the compromise. We read it in the papers, Naledi. We read in the papers from last week and over the weekend. We have seen headlines about the compromise, which unfortunately we don't know about because it was not put to us. I was surprised when I heard that some people are already warming to it in my own organization. So I have to find out what are you warming to and who is warming to it and what is it all about. I found them know nothing. I went to the presidency because they said the president and his allies are warming to it. It's only Dr. Motsoaledi who is and his allies who are dead against it. And I wanted to know what is this that the presidency is warming to, because we don't have any proposal on the table. And up to now, we still don't have it. We're just hearing it being debated over the media, being blamed. Why don't we phone them and look for it? It's surprising me.
Okay.
It's again confirming what I'm saying. Those who have got gold believe they must make the rules, and everybody else believes they are entitled to make the rules and not us.
That's an interesting one, Minister. And so what we'll be doing is we'll reach out to the Hospital Association of South Africa to hear that compromise. And of course, the Minister saying that, well, it has not been presented to him. There's compromise on how the Hospital Association of South Africa says they can assist or get to universal health care with the department. But I want to do this, Minister, because another big talking point over the weekend, Helen Joseph Hospital, this video, and I want to play it quickly, Minister. You can listen. I know you might not be able to see it, but you'll be able to hear it. This video going so viral over the weekend. Listen in.
I believe we should have a healthcare system in this country that anyone can walk into any hospital and get treatment. The concept of the NHI is not something that I'm against. The concept of healthcare for all of us is something that I'm in favor of. But the very same people who are going to create an NHI are the people who are running our institutions at the moment, and they substandard. So I question how the NHI is going to be so much better when it's the very same people who are going to run it. And so, you know, I'm worried that we've got this habit in this country that when there's a crack in the wall, then we put some wallpaper over it.
Yeah, just some clarity, Minister. That was Tom London, the former broadcaster. He was in that particular clip speaking to Newzroom Afrika yesterday. But over the weekend, we saw him go viral with a clip of him at Helen Joseph Hospital where he says he's been receiving the most deplorable treatment by staff, by nurses and doctors. At the Helen Joseph Hospital. He talked about one particular patient who was in the same ward as him and had died. He died 20 minutes prior to him recording that message and no one responding and coming to help. He talked about doctors that while a patient is screaming, asking for help, that they're in so much pain, doctors simply ignoring them and talking about their cars and their holidays, right? You, Minister, say, we're not implementing NHI for business, we're doing it for people. But it seems that people themselves are concerned about how this is going to be executed when they look at the state of our public hospitals. What do you say to someone like a Tom London?
Well, the video was heartbreaking, Naledi. It broke our hearts, but it can't break our resolve and our resilience. And firstly, NHI is not going to be run by the present people because we might not even be there. when it starts being fully established. It's a lifelong process for all South Africans. It will be there for ages. In the same way as the people who started NHS in UK 70 years ago, 76 years ago, actually. Some of those who started are no more, but it's continued. It's being run by people in the country. And that's how we must look at it. Secondly, Naledi, the reason that we want NHI is to avoid situations that he has experienced, that Tom London has experienced. We are not going to NHI is not a vintage system that is introduced because the country is rich. I'm repeating that. It is being introduced because we're experiencing problems. And what are the problems? We've got a situation where we are spending more than R500 billion for healthcare in South Africa, but 51% of it serves only 14% of the population. And if you went to the health facilities used by 14% of the population, which are usually private facilities, he wouldn't have experienced what he experienced. The problem is he went to a healthcare facilities that is used by 86% of the population, with only 49% of the total healthcare spent in our country. And that's what we want to change. We want to change the gross inequality so that people have got access to all the healthcare facilities in the country, public or private, regardless of whether they are rich or not. If we were having, we didn't have Helen Josephs of this world, we are having all vintage hospitals like the one now Tom London is in, then we won't even be dreaming about NHI. Why would we be changing something that is working so well for everybody? We are doing it because it's not working for everybody.
Yep.
And unfortunately, we apologize to him for what happened to him in Helen Joseph. We cannot encourage it. We are very disappointed. I know that the Office of Health Standard Compliance has already sent inspectors there.
Right.
I'm busy writing a letter to ask the Health Umba to investigate, because I don't want Gauteng Province to investigate itself. I want somebody with statutory powers who from outside to find out. For instance, the issue of doctors laughing, as we had, when somebody has died, they're not helping. The Health Professions Council will have to look into it, because all doctors like me, we took an oath of office. And when we were taking an oath of office, we were promising the public that we will treat them with empathy and understanding and not do what we had Tom London saying he has experienced. So it has to be probed.
Okay. Yeah, and we'll be looking for what those investigations do found. Minister, thank you so much for speaking to us. Health Minister there, Dr. Aaron Motsoaledi, speaking to us on the AM Report.